The life of a medical sonographer who went to the trouble of making lunch last night in advance, but then forgot about it in the oven and left it there all night long. I'm not cooking again, and I committed to not buying lunches out this year, so I'll just put it in the microwave for 10 minutes until everything inside is deceased. I get this feeling on the days when it's going to be really busy on the hospital, so I make sure I pack a coffee protein shake on those days. Mornings can be a little bit chaotic. If my husband leaves early, I have to get both kids rounded up and ready for daycare, and then we're all out the door. People always ask me if I know what I'm looking at when I'm doing an ultrasound. The answer is yes, I do know exactly what I'm looking at. With sonographers, we don't just take the pictures, but we also have to write up a diagnostic report afterwards. It has our interpretations, and then it goes to the radiologist who writes the final report. And the next question is always, well, why can't I give the results to the patient? We're not doctors, so we're legally not actually allowed to give you any results. We do give patients some information, but nothing that would be considerably life-changing. If you tore a tendon in your shoulder, I would tell you. But if I found a nasty lesion in your liver, well, that news definitely has to come from a doctor. You have to take a lot into consideration when you do give patients information, because you don't want them to get the wrong idea or stress them unnecessarily. I thought today would be a normal day for me, and I would just go home at 4 o'clock, pick up the kids from daycare, and that would be it. I got called in at 9 p.m, so I had to come in to scan this patient, and then I could go home and go to bed.